Fatty liver is now the number one reason to have a liver transplant.
Hey everyone, today we're diving into a fascinating topic that could change the way you think about food and health. We're going to talk about fatty liver disease, a condition that's affecting millions worldwide, and how you can actually fight it, maybe even reverse it, with what you eat. We'll be exploring Dr. William Li's recommendations on 3 amazing foods that can help rejuvenate your liver and restore its health. So, if you're ready to take control of your health and learn about some powerhouse foods, keep watching.
Remember, I told you the liver's job is to detoxify your body. So what do you think happens when a liver is packed with fat? It can't do its job, all right? It is so full of fat, it cannot properly detoxify your body. We're going to talk about foods that can actually help reverse the fatty liver.
Dr. William Li, a renowned medical doctor, researcher, and author, has spent years studying how different foods impact our health. According to Dr. Li, certain foods have natural properties that not only help the liver function better, but actually help reverse fat buildup. This is huge because it means we have control over our liver health in ways we might not have realized.
Let's talk about what is a fatty liver and why is it harmful to your health. Your liver, which is located in the right upper quadrant, that's on the right side of your body, just under your rib cage, okay, is your body's cleansing and detoxifying organ. And it's actually connected to body fat in important ways, meaning that when you actually store fat normally, energy, fuel in your body fat, your liver actually detoxifies any other things that are running around, but it doesn't have to contend with the fat. However, when you actually have excess body fat and more fuel being stored into your body fat, this is metabolic dysfunction, overeating, putting too many calories in your body is one cause of this, then fat can leak out of the fat cells, okay, out of your fatty tissue, into your blood, and then your liver has to spring into action in order to be able to actually try to clean out the blood. And it stores the fat in the liver itself, so the liver becomes fatty.
Before we jump into the foods, let's take a moment to understand what fatty liver disease is and why it matters. Fatty liver occurs when too much fat builds up in the liver cells. This condition, known as non-alcoholic fatty liver disease, NAFLD, can be caused by a range of factors like poor diet, lack of exercise, obesity, and even genetics. What's scary is that over time, if left untreated, fatty liver can lead to inflammation, liver damage, and even conditions like cirrhosis or liver cancer. But here's the good news: our diet can play a huge role in turning this around.
So, how does all this work? You're eating food, your food are calories, that's the energy in your body. You swallow the food, the calories get absorbed into your bloodstream. When you've got food, your insulin is called into action because basically you're putting fuel into your tank, fuel into your body, and insulin draws that energy into your cells, your muscle, your body fat, stores it. Of course, any energy you need to run the engine of your body is actually going to be used right away. And when insulin actually goes up, it draws the fuel in, and then the insulin levels actually come right back down. And you're eating all day long, and the insulin keeps on coming out whenever you're eating, ready to actually get more energy. And then when you're actually sleeping at night, and you're not actually eating, that's fasting. When you're fasting, sleeping, not eating, insulin levels are down. Your body shifts gears, like in a race car, all right? It shifts gears in from fat storing or fuel storing mode into fuel burning mode. So in fact, at night, when you're not eating, when you're fasting, you're sleeping, your metabolism is actively working to burn down extra body fat. But if you overeat day after day, week in and week out, month after month, year in and year out, what do you think is going to happen? You're not capable of burning all that fat off. In fact, even if you exercise as much as you want, you've actually stored a huge amount of body fat. And when you keep on doing that, all right, overconsumption, too much fuel in your tank, all right, now what happens is that the fat leaks out, the fuel leaks right out of the gas tank. So if you were at a filling station with your car and you filled up your gas tank with fuel, right, we know that it keeps on pumping out until the tank is full and then goes click, the clicker goes on, and now you actually can't put any more fuel in there. All right, now imagine if there was no clicker, right? You just put the fuel in there, you had no idea, you step away from the car, fuel fills up, all right, and then what does it do when the tank is full? It spills out the side of the fuel area, down the side of the car, right around the tires, and it'll pool around your feet, as a toxic, dangerous, flammable mess. And this is exactly the same thing that happens in your body when you overeat. All right, as you keep on going down this pathway that you don't want to be, keep going, keep pushing, keep eating, keep overloading the fuel, then eventually that you don't, even though you've loaded up your fat, you're making more fat, okay, and it's showing, and you feel it, and if you did a DEXA scan, you could measure it inside the tube of your body. DEXA scan is a special kind of scan that looks inside the tube of your body, all right, and you can see the kind of visceral fat there. Eventually, you run out of storage space, right? What happens in your pantry when you actually have too many jars and cans, right? The cans are stacking on top of each other. They're going to start falling off and spilling onto the floor. That's exactly what happens when you overload your body fat, your adipose tissue, which is another way actually to talk about body fat mass. Adipose tissue overloaded with fuel, okay, from overconsumption will start to leak, all right? And this leak, all right, this lipid leak, so it's fat leak, gets into your bloodstream. You know where it goes? It goes right to your liver, and your liver will absorb it into its mass. Again, the foie gras, the duck, the goose, overstuffed with food, liver becomes fatty. That's not what you want. Because not only do you actually have inflammatory, harmful body fat that sets you up for all kinds of chronic disease, but now your liver is overloaded with fat and can't do its job. Now remember, I told you the liver's job is to detoxify your body. So what do you think happens when the liver is packed with fat? It can't do its job, all right? It is so full of fat, it cannot properly detoxify your body. Now you're in trouble because anything, medications, toxins, regular metabolites are not going to get cleared out and processed by the liver in the way it actually should. All right. You know, the liver is an amazing organ because if you were to remove 2/3 of a healthy liver and leave only 1/3 behind, the rest of the liver will actually regenerate itself eventually. All right. So this is a highly resilient and very important organ. So you need to take care of it and you don't want to mess it up with excess body fat. All right. So how do we actually unpack it? How do we walk that back, fatty liver? Well, one thing to do is to burn the extra fat away, all right, and allow that liver to not have to work so hard, unburden the liver, and allow it to regenerate. So let's talk about foods that can actually help the liver regenerate.
So, without further ado, here are 3 foods that Dr. Lee recommends to help reverse a fatty liver. Number 1, beans.
So, food number 1, beans. White beans, black beans, kidney beans, fava beans, lentils, garbanzo beans, chickpeas. These beans, also called legumes, are useful for fighting excess body fat. They've got really good dietary fiber. They feed your gut microbiome. And when your gut microbiome, healthy bacteria, are well fed, they actually ramp up your body's fat-burning activity. All right?
Let's talk about beans, an easy, affordable way to give your liver some serious support. Dr. William Lee highlights beans like kidney beans, black beans, and lentils for their powerhouse benefits. These little guys are loaded with fiber and plant-based protein, which help keep liver fat in check and support overall liver function. The fiber in beans binds to bile acids, encouraging your body to use up excess cholesterol. This process not only aids digestion but also keeps fat from piling up in the liver, letting it work more efficiently.
And a study, in fact, have shown this in the clinic at the University of Toronto. The researchers actually recruited adults who were overweight, all right, 35 to 55 were their age, all right, so adult to midlife, and they gave them 5 cups of canned white beans. So the stuff you get in a grocery store in the middle aisle. Nothing fancy, nothing done to them. 5 cans every week to eat. So think about Monday, Tuesday, Wednesday, Thursday, Friday, take off the weekend as an example. And they did this for a month, all right? And they measured, they did body measurements at the beginning, after 1 week, and after 4 weeks. All right, and after 1 month of bean eating, that's 20 cups of beans, 5 times a week. All right, get the weekend off. After 1 month, the bean eaters had a 1-inch reduction in their waist circumference. Let me explain that to you. Remember the tube of the body we're talking about? Visceral fat's here, right? So you got lots of visceral fat. You're stretching out the tube, all right? And when you burn away visceral fat, what happens? The tube shrinks back to a smaller size. So a month of bean eating shrank 1 inch off the waist circumference, can tighten your belt, one extra loop that's about an inch, and that is a reflection of losing excess body fat, visceral fat, the harmful fat, the stuff that's inflamed. Lentils, as an example, are one of the beans that I told you about. And it's got really great dietary fiber. Dietary fiber helps to process the lipids in your blood as well. All right. So here it is. A half a cup of lentils has 18 grams of dietary fiber. All right. So that's just about half of what you're recommended for the whole day. So just a half a cup of lentils, not very much, gives you half of what you need the whole day. A whole cup of lentils gives you everything that you need for a day.
But that's not all. Beans are low glycemic, meaning they release glucose slowly. This helps stabilize blood sugar levels, preventing the spikes that can lead to fat buildup in the liver. For anyone at risk of fatty liver, this is a game changer. Whether it's a warm bowl of lentil soup, a colorful bean salad, or black beans in your tacos, adding beans to your meals a few times a week can make a real difference.
The thing is that beans, of course, are good sources of protein. So you're getting the protein and burning the extra body fat. You soak them overnight. There's some substance called phytates that kind of come off into the water. Throw that water away, rinse them off a little bit more, and now you've actually removed some of the phytates. Now, why is this important if you've got fatty liver? Is because phytate is a toxin that your body would normally metabolize. You don't get very much of it. It's totally fine for an old person, but if you're actually facing fatty liver disease and you've got kind of cirrhosis and all the problems of a liver that's not working well, or even a liver that's failing, you want to try to get rid of those phytates. So soak them overnight. And by the way, the other little tip of soaking overnight, that you'll actually fart less. You'll actually make less gas. By the way, the other benefit of beans is that beans cause satiety. The nature of the bean, the dietary fiber, when you actually eat it, actually in your stomach will make you feel full. All right, guess what? That means that you're not going to will be as likely to overeat if you're having a meal with beans. And because that satiety lasts for a long time, you are less likely to overeat on your next meal as well. All right, remember, this whole issue of fatty liver, one of the primary causes is overconsumption of food, overconsumption of calories. So eating beans actually helps you burn away some of the bad fat, helps your gut get healthier, lowers inflammation, and is a way of actually keeping you from actually overeating calories all by itself.
Think of beans as your liver's cleanup crew, working behind the scenes to clear out unwanted substances. And the best part, beans fit into almost any meal, making it easy to keep your liver healthy and your meals delicious. So next time you're planning a meal, toss in some beans. Your liver will thank you.
There's a lot of tasty ways to cook beans. I know that some recipes have you throw lard or bacon into beans. I would highly recommend that you use a healthy oil, like extra virgin olive oil, into beans. This is a Mediterranean recipe. You know, you could throw a little bit of tomato in there, some herbs, make a nice bean dish. Go to Google, look up beans, extra virgin olive oil, Mediterranean recipe. Watch a video and see how somebody can make an absolutely delicious bean dish that can help you fight extra body fat and unpack that liver so it can actually repair itself. Very important.
Number 2, tomatoes.
Food number 2, tomatoes.
Let's shine a spotlight on tomatoes, a vibrant, versatile fruit that can do wonders for your liver. Dr. William Lee points out that tomatoes are packed with antioxidants, especially lycopene, which is powerful for reducing inflammation and oxidative stress in the liver. Lycopene works as a shield for liver cells, protecting them from damage that can lead to fatty liver disease.
Tomatoes also are a source of a bioactive to fight harmful body fat. Tomatoes have something called lycopene. It's a carotenoid. Actually helps to make tomatoes red. And guess what lycopene does? You got it. It turns on brown fat, fires it up like a space heater, activates thermogenesis. And remember what we said brown fat does? When you light it up, fires up, generates heat, and it draws that energy from your harmful visceral body fat in the tube. Now you're actually activating your metabolism, burning down harmful body fat, creating heat, and guess what that does? That also unpacks your liver, so you're not actually having that overflow of the fat that can build up in the fatty liver.
Tomatoes also support liver health by boosting detoxification. They're rich in vitamin C, potassium, and other nutrients that help flush out toxins, reducing the liver's workload. Plus, their high water content supports hydration, which is crucial for optimal liver function. Hydrated liver cells are better at processing and removing toxins, keeping everything running smoothly.
Now, what the researchers found is that eating a pre-lunch tomato led to a 2.4-pound weight loss after a month, and most of this came from body fat. 2.4 pounds of weight loss. Now, you might say, a couple pounds, not a big deal. You know what? Let me tell you, eating a single tomato before lunch, that's not a big deal either. This shows you the power of food as medicine. A little can give you something really, really meaningful, all right? By the way, they also studied the weight loss, no loss of muscle or bone, and eating the tomato also lowered cholesterol levels, improved fasting blood glucose, so better for the metabolism, right? You're actually burning down extra body fat, now you've got less inflammation, and now your glucose utilization is better, all right? That's really pretty amazing. Now, there's some other benefits with lycopene in tomatoes. Lycopene is also anti-inflammatory. So you know what that benefit is? You got an inflamed liver, you got inflammatory fat. Now you're eating a tomato, you're also lowering down that inflammation, which actually sets you up for so many diseases. So eating tomatoes like this is actually really, really healthy for you by lowering inflammation all by itself, even if you don't have a fatty liver, but especially if you have a fatty liver. Now, you can eat tomatoes sliced onto salad raw. It's a great source of vitamins. It's got good liquid in it. It's got lycopene, but if you want the highest levels of lycopene and the most absorbed into your body, the best way to have tomato is to cook it into a tomato sauce. All right? Now, let me explain this to you. Lycopene found in nature, so if you pick a tomato off a vine and you eat it like an apple, you'll get some lycopene for sure. But the lycopene is in a form that your body, kind of absorbs pretty well, but not great. If you heat the lycopene up, the heat will gently change the chemical structure of the lycopene into a form your body loves. And this is why simmered tomato sauce, the way that Nonna made it, for pasta, is a great way to actually convert that lycopene. I'm sure the Mediterranean, they didn't know this hundreds of years ago when they first started to invent cooked tomatoes for tomato sauce, but this is modern research, modern chemistry teaches us that heating it actually changes it into the lycopene in a form our body loves to absorb. You want to make even better absorption? Guess what? What should you actually cook the tomatoes down a little bit with? Now, lycopene is fat soluble, all right, so it loves it to dissolve in anything fat and gets absorbed better into your body that way. So why don't you saute and cook down your tomatoes in, get ready for it, extra virgin olive oil. That's right. The thing we just talked about before, add tomato to it, cook it down, and now the lycopene has changed its structure so it'll be avidly absorbed. Now it's in olive oil, and now your body's really going to absorb it. And by the way, the sauce is even going to taste bad. All right.
And the best part? Tomatoes are incredibly easy to add to your diet. Whether you're enjoying them fresh in a salad, cooked in a sauce, or roasted for that rich, intense flavor, tomatoes fit effortlessly into almost any dish. Just a handful of tomatoes daily can supply a good dose of lycopene and other essential nutrients, helping your liver stay healthy and resilient.
Are tomatoes that actually have higher levels of lycopene. So what are they? San Marzano tomatoes, cherry tomatoes, the tiny little lycopene bombs. They're also rich in lycopene. Black tomatoes. We didn't used to see these, but they're kind of like purplish, darkish black tomatoes. They have a lot of lycopene. And then something called tangerine tomatoes. They come with the lycopene in a chemical form that your body's already going to love to absorb. So you don't even need to cook it if you can find a tangerine tomato. All right, let me tell you, eating a single tomato before lunch, that's not a big deal either. This shows you the power of food as medicine. A little can give you something really, really meaningful. All right. By the way, they also studied the weight loss, no loss of muscle or bone, and eating the tomato also lowered cholesterol levels, improved fasting blood glucose, so better for the metabolism, right? You're actually burning down extra body fat, now you've got less inflammation, and now your glucose utilization is better, all right? That's really pretty amazing, okay?
Number 3, carrots.
All right, food number 3, carrots, like tomatoes, are a source of carotenoids. Carrots also have a lot of dietary fiber, right? Bugs Bunny, the rabbit food, got a lot of dietary fiber. In fact, 1 cup of grated carrots has about 4 grams of dietary fiber, and this is actually really healthy. So that's why when you shave carrots into a salad, for example, it's really great. But you can also roast carrots, delicious as well. And if you're going to roast other meats with it, like chicken or whatever, add some carrots in the bottom of the roaster, and now you'll actually, mix the carrots with the drippings of the heat. We'll actually cook it all together. Absolutely a great way to actually cook with carrots and get the benefits of the carotenoid in the carrot and the dietary fiber in the carrot as well.
Let's talk about carrots, a crunchy, colorful vegetable that can work wonders for your liver. Dr. William Lee highlights carrots for their high beta-carotene content, which is converted to vitamin A in the body. Vitamin A is crucial for reducing inflammation and repairing liver tissue, making carrots a fantastic choice for liver support. Carrots are also packed with fiber, which aids digestion and helps remove toxins from the body. When you eat carrots, their fiber works like a broom, sweeping out unwanted substances before they reach the liver. This means your liver has less work to do, allowing it to focus on its primary job of processing and filtering the blood.
Now, what do those carotenoids do? Turn on brown fat. They up your metabolism. They lower inflammation. They improve glucose sensitivity. And this has been shown in clinical studies. So researchers at the University Medical Center in the Netherlands studied 374 middle-aged men, actually 40 to 80, all right, so middle-aged, the second half of life, and they asked them to report how many carrots they ate or other foods that had carotenoids, say the orange foods. And they measured their body fat at the beginning and at the end, and also a lot of their metabolic features, right? So here's what they found. In the analysis, they found that those men who ate the equivalent of 3 medium carrots per day lowered their risk of developing metabolic syndrome by 58%. Let me repeat that. An analysis by the University of Netherlands actually found that those men who ate the equivalent of 3 medium carrots a day to get the carotenoids and get the dietary fiber lowered the risk of developing metabolic syndrome, prediabetes, by 58%. All right. By the way, the same consumption of carrots reduces waist circumference by 1.6 inches. All right, 1.6 inches. That's a belt loop and a half, and a little bit more. And that's less visceral fat in the tube of the body.
Carrots are also rich in antioxidants that help protect the liver from oxidative stress. They combat the free radicals that can damage liver cells, preventing the buildup of harmful fats in the liver. For anyone at risk of fatty liver disease, these antioxidants are a game changer.
You don't need to just eat them raw in a salad. They're great in a salad. You can actually shave them into slice and into little shavings into a salad. It's a great way to have them. Roast the carrots, as I've mentioned to you. You can roast them for a delicious dish. You can just roast them by themselves, okay, with a little bit of extra virgin olive oil, add a little oregano, a little thyme. Absolutely a great way to actually eat your carrots. Okay.
And there you have it. 3 amazing foods that can support liver health and help fight fatty liver disease. Remember, changing your diet is a powerful way to support your body, but it's not the only factor. Make sure you're getting regular exercise, managing stress, and consulting your doctor if you're dealing with any liver issues. Thanks for tuning in. If you found this video helpful, give it a thumbs up, subscribe for more health tips, and share it with anyone you know who might benefit. Let us know in the comments how you're adding these foods to your diet. Until next time, keep nourishing your body, one meal at a time.